Hello, my name is Heather Gosnell, and I'm here to present an interesting case of an aversion to meat leading to post-operative heat. Here, we have a 50-year-old man with a past medical history of paroxysmal atrial fibrillation, hypertension, and obstructive sleep apnea who was admitted after sustaining a tibial plateau fracture. He underwent external fixation and then open reduction with internal fixation 4 days later. The patient first fevered 3 days following the external fixation, which initially resolved with acetaminophen. From here on out, post-op days will be in reference to the external fixation procedure. Beginning on post-op day 5, he had persistent fevers despite scheduled acetaminophen 925 milligrams. Review of systems was positive for diaphoresis, cough productive of clear sputum, and urinary frequency. Notably, he denied dyspnea, chest pain, constipation, diarrhea, dysuria, or calf pain. Initially, the differential diagnoses remained broad, and we began working up the most common causes of post-operative fever. As you can see in the flow chart, we began with a chest x-ray, which was negative for both atelectasis and pneumonia. Urinalysis was negative for infection. Since the D-dimer was mildly elevated, we completed a bilateral lower extremity ultrasound, which was negative for deep vein thrombosis. The wound was monitored during daily dressing changes by the orthopedic team and was without signs of acute infection. Blood and urine cultures were persistently negative. Next, we began to consider drug-induced fever related to any new medications. After reviewing his chart, 2 medications were initiated just prior to the onset of fevers: cyclobenzaprine and enoxaparin. On post-op day 7, we held the cyclobenzaprine, but the patient still fevered over the 24-hour period. On post-op day 8, we discontinued the enoxaparin and monitored for fevers for 24 hours. His temperature decreased throughout that afternoon and overnight, as seen in Figure 1, the fever timeline. He was finally diagnosed with drug-induced fever secondary to enoxaparin use. Upon further questioning, it was discovered that the patient had a mild food allergy to pork products, and this is likely a contributing cause of the acute onset fevers. Like we previously discussed, fevers are a relatively common finding in the postoperative patient. The most common cause of fevers is related to surgical site infections, but additional etiologies can be found in Table 1. Drug-induced fever is defined as fever that starts soon after initiating a drug, stops after discontinuing the drug, and cannot be attributed to any other cause. Antibiotics are the most commonly identified culprit. It has been reported that drug-induced fever could be an adverse effect of enoxaparin use in up to 48% of cases, although the exact incidence is unknown due to the scarcity of reports. The mechanism for the febrile reaction is likely an idiosyncratic response. Hypersensitivity reactions to enoxaparin have been frequently reported in literature, though they typically manifest as a delayed skin reaction in the absence of fever. Meat allergies are relatively uncommon, although exact prevalence has not been well established. It is estimated that 5% of adults have food allergies, and of that small population, meat allergies may only account for 3% of those cases. Our patient is the first reported case of enoxaparin-induced fever in the setting of pork allergy. With his known allergy, his fever likely has an additional component of a hypersensitivity reaction. The key takeaways from this case are: a systematic approach to the diagnosis and treatment of post-op fever is necessary for patient safety and resource stewardship. Enoxaparin-induced fevers should be considered in patients with unexplained post-operative fever receiving prophylactic enoxaparin. In conclusion, drug-induced fevers are a potential cause of post-operative fevers. They require careful review of all medications should the other workup return negative. This is the first reported case of enoxaparin-induced fever in the setting of a pork allergy, and this case should serve as an example for physicians to prompt additional questions into food allergies when prescribing animal-derived medications. Thank you again for taking the time to listen to this presentation.